I am Dr. Nagajothi. I have been qualified as MD General Medicine, but I practice mainly diabetes and cardiac diseases. And I have worked in government institutions, and I have been promoted as professor of medicine. Then I took voluntary retirement. Now, for the World Heart Day, I want to I might concentrate mainly on the diet, because everybody would have spoken to you about the medicine, about the role of lifestyle and modification of the stress, other things. So my topic, I am concentrating on the diet, which is very, very important. Usually we say diet, exercise, and then medicine. Diet and exercise mainly for prevention and then for maintaining after treatment. This diet mainly also prevents the hypertension and diabetes, which are other causes for the leading to the myocardial infarction and other cardiac diseases. Nowadays, we always lead the sedentary life. Instead of sedentary life, we can the exercise part takes away the sedentary life, but nobody concentrates on the diet. Diet is very, very important in reducing the weight as well as to control the glycemic index as well as the fat, which is the main source of our cardiac problem. Eating more fiber, fruits and vegetables will help in reducing the absorption of fat as well as the carbohydrates, which are inimical for the cardiac problem. So we can choose the fruits and vegetables which are rich in fibers and less in calorie. When there is low calorie, your weight will naturally go down. And even if you eat more vegetables and fruits, your stomach will be filled and you won't be eating the other food that much as we take without the vegetables and fruits. Mainly the eating the junk foods as well as salt enriched foods, especially in tinned food and fat enriched food, will lead to cardiac problem. So we advise to go in for a whole grain food instead of a polished rice. You can go for whole grain, red rice or brown rice or barley, as well as you can have whole grain substitutes than regular food in bakeries. For example, whole grain bread. And you can also go in for a reduced salt intake by avoiding the salt-rich bakery foods or tinned foods. You can see the label for the low salt, and then you can choose such food. Our dietary intake daily salt is 1,500 milligrams of sodium per day. Most of the salt is in our regular food itself. So we need not add too much of salt and then add additional burden to our blood pressure. So the other things which will help in our diet is your fat intake. So when you are taking fat, you avoid the trans fat, but trans fat, most of the tinned foods will say trans fat is not there, but also you should see whether there is partially hydrogenated oil in the ingredients. If it is so, it is better to avoid. And unlimited saturated fat can increase the LDL, bad cholesterol, and reduce the healthy HDL. So that can also lead to the cardiac problem. And then we need some amount of fat in our diet. We cannot totally avoid fat. So we have to limit it to 10% of our dietary intake per day. So 10% will help. You can take like, omega-3 fatty acids containing food, and also instead of red meat, you can go for fish, skinless chicken, and eggs. But vegetarian sources of protein, when you are taking, that will also help. And then you can totally, you need not replace the fat or the sugar in the sugar containing, that is carbohydrate containing food in the diet, but you should better reduce them. And also you can avoid the polished grains, and then you focus on a higher fiber food, which will reduce the bad cholesterol. Regarding the fat, the omega-3 fatty acids is present in fish such as salmon, and in vegetables, vegetarians, flaxseed, spinach, and walnuts. And other sources of healthy fatty fats include olive oils, avocados, nuts, and nut butters. So even the vegetarians can go ahead with such diet, and they need not go in for a saturated fat. And higher fiber food is the main source of healthy diet. If you are taking higher fiber tomatoes, carrots, and celery, that is rich in soluble and insoluble fiber, and soluble fiber sources are apple and citrus fruits, pears. So such food always will lead to healthy heart, and you can prevent the cardiac ailment. Of course, genetics will play and other parts will play, but this will reduce the weight, as well as healthy diet is a good way of having a healthy heart. This is my message in a World Heart Day. Thank you.